And welcome. I hope you are enjoying the conference so far. My name is Ashley, and I will be your moderator for this session. From coast to coast to coast, we acknowledge the ancestral territory of all the Inuit, Métis, and First Nations people that call this land home. We recognize the historic and ongoing impacts of colonization and are committed to decolonization of our systems and ongoing reconciliation. I myself am situated upon the traditional territories of the Anishinaabe, Adiwandarung, Miamia, Mississauga, land that is part of Treaty 2 of 1790, also known as the McKee Purchase. This is session HCH2 that will be discussing current landscape and safer solutions for diabetes care among people with lived experience of homelessness. Following the presentation, there will be a live Q&A period. I ask that you please type your questions in the Q&A function located at the bottom of your screen throughout the presentation. And it is now my pleasure to introduce our presenters. Sarah Scott is a clinical research nurse supporting research initiatives at the University of Calgary focused on health equity that disrupts social conditions impacting diabetes outcomes. Drawing from experience and knowledge of meaningful social connections, health equity, dignity-centered healthcare, and humanistic approaches within diabetes self-management. Dr. Hamna Tariq is a third-year resident in internal medicine at the University of Alberta. She is interested both in endocrinology as well as the research that incorporates an exploration of disparities in the delivery of healthcare and its consequences. Dr. David Campbell is a medical specialist in endocrinology and metabolism and a health services researcher focused on social disparities and their impacts on clinical outcomes of cardiometabolic diseases. He conducts academic research that uses mixed methods, interventional approaches, community and stakeholder engagement, and knowledge translation to contribute to reducing the impact of social disadvantage on clinical outcomes by informing health policy and clinical practice. Thank you so much to all of our presenters today, and please enjoy this session.